Last night, Jane, a 20-year-old college student at the University of Missouri, had a little bit too much fun. She ended up in the university hospital after injuring her wrist following a night out that included one too many alcoholic beverages.
Good morning, I'm Kelly. I'm a nurse on duty this morning. How are you feeling today? Obviously, I've had better days. Oh, I feel ya. We've all had rough days. Are you up for a few questions before the doctor comes in? Sure. Well, I want to ask you about your substance use. Seriously? What substance use? I don't have any sort of problem if that's what you're getting at. I understand. This is just your routine screening. Is it okay if we continue with this conversation? Fine, but make it quick. Do you smoke or use tobacco products? No, that's nasty. Who wants to taste like an ashtray? Good point. Let's talk about alcohol. In the past year, have you had 4 or more standard drinks in one day? Well, what do you consider to be a standard drink? I've never kept track because I usually drink out of a solo cup anyway. Technically, it's 12 ounces of regular beer, 8 ounces of liquor, 5 ounces of table wine, or 1.5 ounces of hard liquor. You can actually use your solo cup to measure this. The first line is a shot, the second line is a wine cooler, and the third line is a standard beer. Oh, in that case, yes. Knowing that now, would you say that in a typical week you have more than 7 drinks? Well, probably. Not every week, but definitely some weeks. Definitely the stressful ones. Okay, so in the last 12 months, have you used marijuana or other street drugs recreationally or prescription drugs for anything other than their intended use? No, I'm not some kind of addict. I drink like every other college student. Okay, we'll focus on your alcohol use then. Do you mind walking me through a typical night out? Well, I usually pregame a little with my friends when we're getting ready. And then I pretty much drink whatever I can get my hands on at whatever frat's having a party. But my friends and I kind of like to bounce around, but we're good at keeping track of each other. Okay, that's good that you guys look out for each other. Yeah, we call each other battle buddies. I've never heard that before. What exactly is a battle buddy? Well, it's just basically someone who watches out for the rest of the group when we're out. Hold your drink for you when you go to the bathroom, ward off creepy guys. Kind of like an ED, even though we walk everywhere. That's a really cool idea. Does the battle buddy make sure the rest of the group doesn't drink more than they want to? Kind of, but we don't always listen to her. That's how this happened. Okay, is this the first time that you've hurt yourself or someone else while you were intoxicated? Well, I've fallen and hurt myself a lot when I'm drunk, but I've never hurt anyone else. Like I said, we walk everywhere, so I've never driven under the influence, and heel-swiss alcohol would make anyone clumsy. That's good that you've never driven. But in the past year, have you thought about cutting down on your drinking at all? I mean, I've thought about it, but I'm in college and I want to have fun. Otherwise, partying is no fun if I can't drink. I'm no different than any of my friends. I'm bringing this up because I noticed your alcohol use is above the safe daily or weekly limit. Do you mind if we talk a little bit more about your drinking? I guess. I mean, you're probably going to make me do it anyways, so why not? I'm glad you're willing to talk about this. Since your alcohol use is above the safe limit, I'm concerned about your health and safety. Why are you concerned? I don't drink any more than any other college kid. Well, do you ever use drinking as anything more than a social activity? Are you saying that I'm an alcoholic? I sometimes drink when I've had a stressful week or when I'm feeling bad, but that's a normal thing to do. College just hasn't been what I expected. I understand that college is a rough adjustment for a lot of people. Would you like to talk about it? Well, I'm failing college algebra and I'm not doing well in my other classes. I'm worried about my GPA and I'm worried I'm going to lose my scholarship. Do you think your alcohol use could be affecting your grades? I mean, I'm not drunk in any of my classes. On the one hand, your grades are dropping, and on the other hand, you're saying your alcohol is not causing you any problems. So what do you think is causing your grades to drop? I don't know. The classes and the tests are just getting harder and harder. I don't have as much time to study or do my homework. I feel like a lot of students feel like that from time to time. Are there any other stressors in your life? Well, my boyfriend broke up with me, but boys are stupid, so I don't really care. How have you dealt with that? I've been spending a lot of time with my friends. It's good that you have such a great support system, but what I heard earlier is that drinking is something that you and your friends always do together. Has this led you to increase your alcohol consumption? I mean, maybe a little, but they're just trying to cheer me up. Has drinking made you feel any better? Definitely. I have a lot of fun when I drink,
and partying is so much better when I have some drinks. I've been able to meet so many new people recently, and it's taken my mind off my ex. It helps me relax, and it definitely makes me happy.
I understand having a social life is important in college because it can be a stressful time for everyone. Is there anything else that drinking adds to your life?
I mean, I'm more fun when I'm drunk, and it makes me feel prettier. I feel more confident when I've been drinking.
You seem like a very confident woman to me because you've shown a lot of maturity by having this conversation with me.
Yeah, I definitely did not expect to have this conversation.
Are you alright continuing talking about this?
Oh, it's fine. I guess I probably should start thinking about how my drinking is affecting me anyway.
I would like you to consider cutting back on your alcohol use. If you reduce your drinking, how would your life be different?
Well, my grades might be a little better if I spent more time studying instead of going out. And honestly, my boyfriend probably wouldn't have broken up with me if I didn't drink as much.
Is alcohol a factor in a lot of your relationships?
Not really. My boyfriend just didn't like how much I went out drinking with my friends. He was worried that I was gonna do something stupid, which I guess I did.
It seems like he was looking out for your best interests.
It just seemed like he wasn't accepting that part of my life.
What I hear you're saying is that alcohol had an effect on your relationship.
Yeah, I guess you're right. I don't want that to happen again if I start dating someone else. I always thought that drinking was helping me socially, but I can see how it's actually hurting me, and I don't like that.
Okay, on a scale of 0 to 10, with 0 being not ready to change and 10 being ready to change now, how ready are you to change?
I mean, probably like a 5.
A 5? And why did you say 5? What separates you from those that are at a 2 or a 3?
Well, I'm starting to see that alcohol is affecting my life, and I never really thought about it before. But now I feel like I should start thinking about it because there are more things in my life being affected by alcohol.
By expressing a willingness to change her drinking habits, Jane is in the contemplation stage of change.
Okay, so what are some ideas you have for changing or cutting down?
Well, maybe instead of drinking, I can go to the gym when I'm stressed out.
That sounds like a great idea. Do you have any other ideas for cutting down?
Maybe my friends and I could study together sometime instead of drinking. And if we do party, maybe I can alternate an alcoholic drink with a non-alcoholic drink.
Those sound like some great ideas. Would it be alright if we wrote down some of the ideas we talked about today so you can think them over and have them for when you leave?
Sure, that's fine.
Okay, so we talked about how alcohol is a big part of your social life. But you started to realize the effect of it on your grades and relationships. So those would be negative, and we want to fix that.
Yeah, my grades aren't so great right now.
Okay, so we talked about some ideas of how you can cut down. So you said going to the gym is a stress relief. And that can also be a social event with you and your friends if you go with a friend to the gym.
I never thought of it that way.
Yeah. And then we talked about finding alternative ways to spend time with your friends, so you could maybe go to the movies or go shopping or do something like that with your friends instead of drinking. But as for your grades, what could you do to bring those up?
Well, like I said, I could probably study with my friends instead of going out sometimes.
Okay, have you ever thought about getting a tutor?
Yeah, one of my friends is actually really good at college algebra, so I probably should ask her to help me out instead of going out on Thursday nights.
Okay, that would be great. Maybe you should contact her.
I could try that.
Awesome. I'm going to give you this paper so that when you leave, you'll have this and you'll know exactly what we talked about today.
Thanks.
Okay? And can we set up a follow-up appointment to talk about this again, maybe when you come in for your wrist again?
Sure, that sounds good. When do you think that's going to be?
You can set up an appointment at the front desk when you leave. It'll probably be in a couple weeks when you come back for your wrist. And I really look forward to seeing you again.
Thanks. It's been nice meeting you. Nice to meet you.
I hope your wrist feels better.
Thanks.
Based on Jane's readiness ruler identification at a 5 instead of a 2 or a 3, and her openness to change, it is evident that she is in the contemplation stage of change and has some good ideas for change. Jane has come up with new ways to improve her grades, find alternative ways to associate with her friends, and considers going to the gym instead of drinking alcohol.